There are a lot of people talking about maybe the entire model should change. Maybe the NHS in its current structure is not fit for purpose. Someone who might not agree with that or might have a different opinion from mine is Dr. Tony O'Sullivan, as he is co-chair of Keep Our NHS Public. Tony, it's great to have you on the show. Now, a lot of people like me who have lived over in continental Europe and have had the pleasure of enjoying the efficiencies of the Belgian healthcare system think, well, that worked so well. Why aren't we doing that over here in the UK? As long as it's free at the point of access, surely the most important thing is being able to get in front of a doctor. When you look at the current model of the NHS, do you think it's sustainable to keep it going? Is it just that it needs more money and more resources?
Well, good morning, Alex. For those of us that have memories that go back to 2010, we know that at that point, the NHS, which was well supported and well funded, comparable to the leading European nations, was actually the best health system amongst all those comparative nations. And we know that it worked really well then. The satisfaction amongst the public was at its highest. It was over 70% thought it was good or very, very good. So we know that the system works. And we also know that countries such as Belgium, France, Germany, Switzerland pay a huge amount more for healthcare than Britain at the moment. So if we were funded at the same rate per head of the population as France, for example, the NHS would have been receiving about £40 billion a year more for the last 14 years, adjusted for inflation, etc. So we know that, first of all, the NHS is a model that works very well when it's supported and funded well. We know that we can't afford not to have an NHS. We know that nearly 3 million people are out of work for health-related reasons, and that's gone up by nearly 1 million since the pandemic. And we are short of labour in this country, where we need to invest in our economy and the health of our population in the country. So we can't afford not to have an NHS. I've been to France recently, and I know that healthcare there is good. It also is a lot more costly in this country. So if we were interested in where our money goes as taxpayers and individuals, we should want the best, forgive the jargon, best bang for the buck, and that is a publicly provided NHS. Of course, the prospect of numbers of patients waiting coming down with what West Streeting is talking about, we all want that, and we want better for patients. But the investment short term must strengthen the NHS long term. And one of the things that we would argue is that it mustn't divert money to the private sector, which has in its constitution the need to raise extra profits for their share investors. The beauty and the success of the whole NHS when it's working well is the interlocking system, the GP, primary care, community care, social care, mental health, emergency medicine, hospital care. But at the moment, the whole system is in a state of real stress, and it's stuck. Yeah, and it's stuff too.
I'm going to bring in Peter Barnes, who's with me today, because he's got lots of interesting points to make on this topic. I mean, Dr. Tony O'Sullivan's there saying, actually, it's the breakdown of what was once a very efficient interlocking system, that when we were properly funding it, that it would actually, it was, everyone loved it, and it was the envy of our neighbours, and actually we're underfunding it. And when you look at some of the models, the hybrid models that I've been talking about, they actually cost the end user a lot more.
Yeah, that's perfectly fine if we're judging things on the 1960s and 70s. That's because our population was significantly lower, and also, more importantly, the health challenges that the NHS faced were very, very different.
To be fair, he was talking about around sort of, 2010 and that
even
sort of
in
era.
2010, but you're still looking at a huge societal change between 2010 and 2024. You're looking at a huge population increase. And yeah, I will admit that, the amount of money has decreased in real terms and all this kind of stuff. But I go back to the point is that we have given the NHS this money, and it has wasted this money. That is my big argument, is you keep saying we give it more money, give it more money. Fine, we can argue that all until we're blue in the face, but what you're spending the money on is ridiculous. The NHS England just alone spends £40 million a year on DEI training, not on all of it, just the training. You have to start asking, is the money going in the right places? And there is one element to which we never talk about, and with a big obstacle to the NHS reform and actually saving the NHS, and that is organisations like the British Medical Association, the trade unions. They have stood in the way of actual reform that would help patients and help save the NHS. But more than anything else, I am absolutely sick to the back teeth of all these people running around saying, you know, we've got to keep it public, we've got to save all these things, and yet they support organisations that stop it from actually prospering. You know, yes, the private sector has a kind of profit-driven ideology, but that it doesn't necessarily mean that it has to be at the expense of patient safety or patient care. You can have both. It is nothing but scaremongering again.
Let's go back to Dr. Tony O'Sullivan here, because actually one could argue that the last Labour government brought in so much more of the private sector into the NHS with things like PFI deals. Is that something that you think needs to happen again, that actually it is a system of working with private investors and private companies that might bring about efficiencies and modernisation?
Well, the evidence is, and I'm a retired doctor now, but I do believe in evidence, and what Peter just said is evidence lacking. The evidence is that PFI hospitals have been extraordinarily expensive. So for about £11 billion of investment, it's going to cost the taxpayer over the period of time something like 80 billion. Extraordinarily expensive. A government that can borrow money the size of Britain can borrow money much more cheaply than PFI contracts have proven to be. So I really think that's wrong.
Yeah, again, sorry to interrupt, Dr. Tony.
Just let me finish this last little bit. The other bit of the previous Labour government was a claim that they're resurrecting now, that the use of independent sector treatment centres got rid of the waiting list. But in fact, Alex, it wasn't that. It was the raising of funding of core NHS provision to the level where they could meet the need and get waiting lists down. That was what got rid of the waiting lists. And it was actually a model that turned the NHS around and turned the population's health around to such an extent, as I said, that there was the best popularity for the NHS ever in 2010. And now it's the worst ever. And it's not because it's a historically jaded model. That's completely wrong. It's a model that has always changed with times. I'm a doctor. I develop my own services constantly in southeast London. I'm a member of the BMA. I still am a member of the BMA. I'm a member of a trade union. We did not stand in the way of progress. We were actually arguing for progress. And when that was allowed and funded and given support to, then it's the trained doctors, nurses, technicians, therapists who actually are the driving force and the jewel in the crown of the NHS. We should rely on them.
One thing I want to ask you, because look, I don't really know anything about how the NHS really operates other than being a user. I did actually work for the NHS once, though. When I was a student at school, I used to work in the admin side of things, doing creditor payments and even fraud investigations. You'd be amazed actually how many of those take place. But one thing that I always feel as a user of the NHS is the bottleneck that happens through GP surgeries is a major problem. If I just compare my experience of living in, say, Belgium, where if I wanted to go see somebody because I had backache, I could go directly to that person, compared to everything in the UK. I mean, I was trying to phone my GP surgery this morning and 2 hours later they give me a call back. Is that something we need to look at, that we've got this huge issue in trying to funnel everybody through one door before they can even get into the system? Once you're in the NHS system, then actually it can function very well. But actually just getting into it in the first place is where a lot of patients are finding the most difficulties, and that can have critical costs.
Yeah, well, there's been almost a conscious, deliberate neglect of primary care over the last several years, and from the previous government as well, to be honest, but certainly in the last 14 years. So the numbers of GPs per head of the population has fallen. the numbers of patients per full-time GP has gone up to such a level that even though they're working incredibly hard, they can't keep pace with the demand. And on the other hand, there is still a very good functioning GP service. It varies from parts of the country. You have postcode lottery. And I think that could be turned around very much if the current government commits to primary care, which Wes Streeting says he is going to. But for me, that means giving patients the right to have continuity of their GP, to have enough GPs and the wider primary care team to meet the needs of those patients, and that can be absolutely turned around. Now, the somewhat obsession of IT and artificial intelligence that Wes Streeting is allied to, everybody knows that a good, important business or service needs good IT, and that has also been neglected. So it's a mixture of basic infrastructure support for the NHS, respect for NHS public staff, including your work experience, including secretaries who are and admin staff who are actually the oil that makes the NHS work. So it's a recommitment to me that is needed of public servants providing public service with the only intention to provide better care and not to be worried about the profit taking from the corporation that you might be working for. And I'm afraid Peter's wrong to say that the private sector will be a safe alternative. We know that private care has real risks attached to it. They don't, for example, operate with an intensive care or high dependency unit to support backup when surgery goes wrong. And there is a distortion of the relationship between patients and healthcare when, for example...
Yeah, I mean, I think when we talk about, private care, and I can pretty much assure you that when it comes to the hospital in Belgium, where I had my surgery done, there was definitely all the facilities needed if things had gone a bit wonky. Dr. Tony O'Sullivan, thank you ever so much.